Hello, everyone, and welcome to day 2 of Provoke's 2020 Global Summit. Obviously, it goes without saying, it's a shame that we can't do this in person as we do every year, or have done every year for the past 8. But this is perhaps the next best thing. Thank you to everyone joining us today, and those of you rejoining us perhaps after participating on Monday and on Tuesday. We have a very compelling agenda for you this morning, this afternoon, or this evening, depending on what time zone you're in. As you can imagine, we're going to continue from yesterday by really trying to examine how brands and agencies are responding to this year's turbulence and transformation. We will be looking, first of all, at the scientific and healthcare response to COVID-19. We'll also be exploring the long overdue reckoning with race that is underway. And we'll also talk about the backlash against technology companies. So from all of us at Provoke Media, thank you for joining us. I need to also thank our partners. This event would not be possible without them. There is a slide which shows their logos, and I'm not going to read all of them out, but thank you to all of our partners. The response from the market has really been amazing, and as Paul mentioned yesterday, it's it goes well beyond commercial support to true intellectual support and helping us deliver this kind of thought leadership on an annual basis at this event and at all of our regional events too. So a few housekeeping notes. Please do contribute questions via the chat function. You can converse on social media with the PRovokeGlobal hashtag. I need to give a big up to the relentless Provoke team. They are delivering session recaps in real time. We'll also have videos for you of each session eventually. And we have a fantastic session to start things off today, one that I am personally very interested in, featuring none other than Pfizer Chief Corporate Affairs Officer, Sally Sussman. She's going to be talking about the role biopharma is playing in this new world and what that means for corporate affairs leaders, what it means for agencies. It is a session that I think will focus on transformation, not least because it features Sally, but because it's led by Ana Maria de Salva, who is Chairman and CEO at Hill+Knowlton Strategies. With that said, I'm very happy to hand over to Ana Maria. You're going to get 2 extra minutes, so you can thank me later. Ana Maria, over to you. Thank you.
Well, thank you so much, Arun, for that introduction. Much appreciated. And by the way, thank you on behalf of all of us for the great work you and the team at Provoke do in providing this forum. And you're right, it's too bad we can't all be together, but so great that we could be together on a virtual basis because these conversations are so important. And look, I couldn't be more excited to host this session with Sally Sussman. And as many of you know, Sally is Executive Vice President and Chief Corporate Affairs Officer at Pfizer. She leads communications, government relations, policy, philanthropy, patient engagement, and now also investor relations activity around the world for Pfizer. Sally also serves on the board of WPP, and she is co-chair of the International Rescue Committee. Sally is also a member of the Council on Foreign Relations. And all of this following leadership roles earlier in her career at the Estee Lauder Companies and the American Express Company, and 8 years in government service focused on international trade issues. So no surprise that Sally has become such a distinguished leader in our field, and we're so fortunate to have her with us this morning. What you probably don't know, many of you in the audience, is that Sally recruited me away from H&K in 2009 to join her team at Pfizer, and that was to lead the turnaround of R&D from a corporate affairs standpoint. And I did that for 5 memorable and really formative years. In 2014, she supported me when I had the opportunity to join DuPont as CCO, and she remained a voice of encouragement as I led that team through some really extraordinary special situations, including the mega merger with Dow. And I remember getting, 1 or 2 sentence emails or texts from Sally every once in a rare while to reinforce and encourage, which I deeply appreciated and still remember. As a WPP board member, she helped to recruit me back to H&K to become CEO last year. So for me personally, this is an important conversation with a leader and a friend who means a lot to me, and a company in which I still feel really profoundly invested, and which I'm proud to say is in many respects leading the way to deliver the science-based solution that alone can solve today's global health and economic crisis. So with all that being said, Sally, thank you so much for joining us. And look, I think, we have 2 extra minutes, but we have a lot to talk about. So,
well, thank you so much, Anna Maria, for inviting me. And I wish I could wake up every morning to an introduction by you. That was very uplifting for me. And as always, an honor to share any stage with you. As you said, we are former colleagues, current friends, and I think mutual mentors. So this should be a lot of fun, and thanks again for having me.
Thank you for that. Well, look, let's start with what's on everyone's minds, because this is a rare chance to hear from someone who's playing a principal role in the development of a vaccine. So in a nutshell, where do you think we are with vaccine development, and what's the roadmap between today and a globally scaled vaccine?
Thank you. I mean, thanks for that question. It's completely relevant. If you don't mind, Anna Maria, I'd like to just take maybe a minute or two to back up and tell you how we got to here and then where we're going.
Yep.
So if we remember back to January of this year, it was a scary time when, excuse me, we started getting reports from our colleagues in China about this COVID coronavirus. I remember the country manager at Pfizer China calling me and saying that the streets of Beijing were empty, and how eerie that was.
Yeah.
Then in the February timeframe, WHO declares, an emergency state. We get our first cases spiraling around the globe and here in the United States. And then in March, we have a full-blown crisis here in the US. I remember on March 10th, Pfizer closed our headquarters on 42nd Street and we went to remote working. I've been working that way ever since. In fact, I joined everyone this morning from my bedroom in Manhattan. So, we began with a kind of dramatic start to the year. And at that time, Pfizer CEO Albert Bourla said we needed to do 3 things as a company. First, to take good care of our 90,000 people around the world, all of whom, have been working in difficult conditions. We have frontline workers in our factories. We have frontline workers in our labs. Secondly, that we wanted to ensure the steady flow of medicine to people who need it, hospitals, doctors, clinics. And third, and here's the big one, that we would try to bring a vaccine forward by the fall. And Albert predicted the fall because he knew there would be a resurgence after the summer, that it would be a more difficult time. And so since March, we've really been working in an extraordinary way to try to bring this vaccine forward this year.
Yeah.
And the essence of it is, as you know very well, Anna Maria, drug discovery is a long and complicated process.
Yeah.
And it usually happens in a linear way. First you discover, then you develop, then you begin the regulatory process, then you think about manufacturing, and ultimately, sometimes anywhere from 4 to 14 years later, you can get a drug. We've done all of that, what is usually sequential, at once to bring forward our COVID vaccine this year. And right now, where we are precisely to your question is we are awaiting our efficacy readout. We need 3 readouts. Is it effective? That we're going to know hopefully this month. Second, is it safe? Which we expect to know in November. And third question is always, can you produce at scale with quality? And we've already begun. We've been producing our vaccine. We have tens of millions ready to go if we get approval. And of course, that's the big if that keeps us up at night.
Yeah. And Albert, I noticed that Albert has communicated recently that it looks like you'll be able to file, shortly, and that it could be that the emergency use of Pfizer's vaccine could begin even by the end of this year, which is extraordinary. Do I have that right?
Yes, and that's exactly the plan that we have The US government has reserved doses, as has the European Union and other locations, all for delivery of our vaccine this year.
Now, a big part of what Pfizer brings to the table is this incredible manufacturing prowess and this extraordinary ability to manufacture vaccines expertly and safely and at extraordinary scale. And that's a huge part of solving the COVID problem. How long do you think it will take to scale the vaccine once it's approved?
Mm-hmm. The manufacturing part of this is so exciting. And I encourage everyone, there's a Wall Street Journal story today, this morning, about this manufacturing magic that's going on. As we are producing in two places. One is Kalamazoo, Michigan. The other is Pours in Belgium. Again, tens of millions to get to hundreds of millions, and ultimately next year, 1.3 billion vaccines produced by Pfizer. The complications and the hurdles have been so interesting and fascinating. I mean, I know you're very familiar with the cold chain requirements of a vaccine.
Mm-hmm.
We're very good at this. We've done it with many vaccines, but please know this coronavirus vaccine travels at -70 Celsius. So it's planes, trucks, dry. We're producing our own dry ice, everything to make this happen. And I'm so moved, really, and proud of the Pfizer manufacturing. It is something people don't often think about in the complexities of drug development. They think about the scientists, of course. They think about all the experts, but really manufacturing has been a dynamic and crucial part of this process. I'll also mention, you can see in the Wall Street Journal today, we've designed a special travel box that will carry about 1,000 doses per box in a carefully constructed box that includes dry ice. And on top of it is a tracker. So we can see at every moment where the box is and what temperature it's reading. It's fascinating.
That is fascinating.
Mm-hmm.
One thing I remember as this whole enterprise got going is the extraordinary collaboration across the industry and how we were also struck by that. And and as I recall, there was even an intention to collaborate across and consolidate manufacturing capabilities so that we could get to scale. And many people have asked me, because I'm a veteran of the industry, because I spent 25 years in biopharma, really, before crossing over into an industrials at DuPont. People have wanted my point of view on how the industry came together and to the degree to which that's had a multiplier effect on our ability to innovate. And I'm just wondering, from where you sit, how you think about the industry's collaboration.
I love it. And I think it's unprecedented. I mean, you've been in biopharma longer than I have, but it can be a pretty cutthroat industry at times, but not at this time, not during COVID. And I'll just give you three quick examples of the kind of collaboration you're asking about. First, way back in March, in the early days, Pfizer produced a 5-point plan on collaboration. And it talked about how we wanted to work differently, that this wasn't a business as usual scenario. And most importantly, establishing that the enemy, the competitor, is the virus. And that was an important transition. It allowed us to reframe the discussion with the bad guy is the virus and of course time. So the 5-point plan was one example. A second example is Pfizer is manufacturing for others some of the key medicines that are needed. So remdesivir, which is a medicine produced by Gilead, it's a treatment for COVID. We are manufacturing partners with them because we need to work together. And then third, I'm sure everyone has seen that there's been a lot of politics being played in Washington between the FDA and the White House. And the industry, frankly, was kind of caught in the crossfire of that back and forth. And so Pfizer led, together with J&J, a pledge, a 9-company pledge, saying that we all stood by science, not politics, science. And we ran these ads. They were produced with your advice, Anna Maria, and together with other WPP partners. full page ads, 9 companies' names on them in support of science. And that, I don't think that kind of thing would have happened in a different time. I think it's really a reflection of the way we want to stand together and to be cooperative with one another.
Agreed. And it's been, you know, for all of the challenges, and this has been in so many ways such a dark, troubling time. On the other hand, the challenge of COVID has speeded and accelerated so many positive things in the transformation of a science company like Pfizer. And also, it's been a tailwind in many respects for the corporate affairs function, because you've had to step up and really be the tip of the spear in so many respects in dealing with these extraordinary communications, but also reputation and political issues. And I'm just wondering, you know, how would you say you've responded to the intense interest and frankly being in the political crosshairs in an election year?
Well, I could respond to this question for hours. It's been the most fascinating time in my nearly 40-year career to be doing this work at this time. And Paul Holmes was mentioning a piece that they've written about a resurgence of our profession. When all this started, I knew that I needed a basic plan in order to keep myself focused during this time.
Mm-hmm.
And my plan is simple. It has 3 elements. The first one is we need to back this vaccine to the hilt. You know, there's a lot of skepticism about vaccines in the best of times, but now in a political environment, in an election year, during a pandemic, we need to be extra smart and extra vigilant about talking about the attributes of the vaccine, being transparent about our processes. We posted our protocol for our trials, something we've never done before. So, you know, job 1 is to really lead the conversation about this vaccine. Secondly, because I believe we are making history, certainly for our company, but potentially for humanity, I've leaned heavily into documenting this experience. You and I've talked about that, Anna Maria, but we're engaged with documentaries with HBO, CNN, Nat Geo, Disney, because this is a story I'm going to want to tell my grandchildren. In fact, I'll tell anybody this story who will listen to me. And then third, as Pfizer is transforming from a large, diversified consumer products and pharmaceutical company into a lean, agile, science-based innovation company, this vaccine will be a proof point for us in that transformation journey, for good if we're successful, and for ill if we're not. And so linking what's happening today to what the story is we're trying to tell for Pfizer tomorrow has been driving us. And just a point about the politics, because Pfizer was caught in the crossfire a bit of politics and name-checked in the first presidential debate, we wanted to get out a simple message that Pfizer is moving at the speed of science, not the speed of politics, that we would never succumb to political pressure, that we have a obligation to our 171-year history to take the good and true path. And Albert sent this in a letter to 40,000 US employees. It went viral. That was sort of a plan. And it's just in a time when you have to stand up for what you believe in and be very clear about it.
I mean, it's just such an extraordinary example. And, you know, I'm trying to distill down what the lessons are for everyone in the audience who might find themselves at one time or another in maybe not as quite an intense situation, but in a politically fraught situation. And it just seems as though that transparency, that focus on principles, and that transparency is really central to success. But is there anything else that you would advise us?
Yeah. Building on what you're saying, as communicators, corporate affairs leaders, our job is not politics. Our job is policies. And so I think about what are the policies out there that are pro-patient, because if it's pro-patient, it's pro-Pfizer, and not to be drawn off. I mean, I chair Pfizer's political action committee, so I care about politics, and politics is a personal passion of mine. But I think for your listeners this morning and for people who are facing any kind of political crossfire, you need to stand on principles and on policies, not on politics.
Yeah, well said. One of the things that's been just, extraordinary for me as a practitioner, but also as a veteran of the industry, but somewhat, I still feel very much affiliated with the industry, as you can imagine, and with Pfizer for that matter. It's just been incredible to think about how the industry has been one of the most scrutinized and criticized industries ever in all of industrial history, and yet, here we are, essentially the one industry who can truly solve this health and economic crisis and make it possible for the world to turn the page. And I've been waiting with bated breath to see whether or not the industry will convert this moment to create a step change in reputation and trust and goodwill and equity with all of its publics. And do you think that will happen?
Well, I certainly think about it all the time. I mean, I came to Pfizer almost 13 years ago with what I thought was a simple challenge. I had worked at American Express, where the credit card was very, very popular. I worked at the Estee Lauder companies, where that family that runs a company are treated like conquering heroes wherever they go. And here I was coming to a company that brought the world penicillin, that was making breakthrough medicines in oncology and other dreaded disease. And yet it was a reviled industry. Our polling numbers showed us down at the bottom next to tobacco. And I thought, oh, this is ridiculous. This is a problem I'm going to fix. It'll probably take me a year or two. And I spent the next 12 years working against this problem and understanding it and trying very hard to change it. Now we have a chance. We have a chance with this pandemic. Certainly, I've never faced or enjoyed so much interest. Our phones ringing off the hook. Not only is this big story in the Journal today, there's a big story in the New York Times today. The press volume, the number of government leaders across the globe calling us for our input, having friends and family dying to talk to me about this at all times. It's an exciting, exciting moment. But to the heart of your question, what I ask myself all the time is, how can this moment become a movement? And how can it be a paradigm shifting opportunity for the industry? And what it means is that every single step we take must be done in a way that shines a positive light on ourselves and our future. And that's why Albert Bourla, Pfizer CEO, convenes a call every day with the key players in this vaccine quest. So it's the researchers, the manufacturing people, the regulators, and me. And it's a small group, but it's because he knows that the public component of this is essential. Yeah. And at every turn, are we building trust? Are we planting the seeds for our company going forward? And that's why it's truly a renaissance for corporate affairs at Pfizer, but across the biotech industry.
Yeah, well said. And, I'd like to kind of double click on that a little bit, and in keeping with the article you mentioned that Arun has published. I think of you as being one of the most visible leaders in our field who has successfully consolidated the corporate affairs disciplines. So yes, communication, but also the adjacent disciplines, that when we integrate them, we can provide higher quality, faster, integrated solutions for the business. And I think in doing that, there's more impact and value. And I think that's been very visible, especially in healthcare. So, reflecting on your experience in corporate affairs writ large, what do you think the paradigm will be going forward for communicators, especially those who begin to play bigger and to bring many of these disciplines together?
Mm-hmm. Well, it's certainly a framework that I believe in and that I have fought for in my entire career. I think the build out of putting all of these external facing jobs together makes a lot of sense. And even that's why I was recently added investor relations to my portfolio, because that's an important external audience. I think it simplifies things when all of these disciplines come together And I also have a daily call with each of the leaders of this area, and we can support and amplify one another's work. If there's something happening that the policy team knows, but the Washington office isn't aware of, or the media team doesn't know, that's a missed opportunity. And we can't afford any missed opportunities right now. So I think knitting these things together is very important. But I would also like to just say, for people who are listening and are maybe probably at earlier stages of your career, I didn't have it all at once. And when I first came to Pfizer, I made this argument and I failed. And I was leading singularly communications. Then later, the foundation and philanthropy came in. Then later, politics and government affairs came in. And I think it's important to build a career over time and to expect that you will be rewarded with more as you earn it by delivering and contributing for your client or your company.
Yeah, well said. And it is a journey, you know, and we have to engage constructively with CEOs and executive leadership with whom we partner to demonstrate and to make that case over time. If we switch gears a little bit and start to think about the advisory services side of the business, which of course is now my daily mission and purpose in life, you also have a unusual perspective because you're a non-executive director of WPP, the world's largest holding company of marketing services and public relations and public affairs companies. So you have a rare view of the role of agencies and consultants. And how do you think about the future? What do you need, or what would you advise us leading in that part of the industry to prioritize and think about and really commit to for our future success?
Great. Well, I do very much enjoy and feel honored to have a board directorship with the WPP companies. And I know you also, Anna Maria, serve on external boards. And I think you'll agree that that opportunity is great. And I encourage people, whether it's a volunteer board or a public interest board, or even ultimately a public company board, to strive for board service, because you do see things from the other side of the table. And in these meetings at WPP, I get to refine my skills and sharpen my thinking about the sector overall. I'm a huge fan of the advisory sector. And even though I have spent my entire career in-house and haven't, run the obstacle course of life in an agency, I frequently hire from agencies. As you said, I worked hard to recruit you earlier in your career from Hill+Knowlton. And most of my top people come out of agencies. I think the training is superlative. And the nice thing is, when you work with people in an advisory capacity, you get to know each other. It's sort of a little bit like dating before getting married. You can find out, do I like them? Do they like this company and this environment? So I think it's an incredible pool for talent. And also, I think that the agencies that are the best, and I know a lot of them are on this call. I looked at Arun's sponsor slide, and I think I see many great agencies, and lots of good friends are probably on this call. The ones that push us, drive us, challenge us, speak truth to our so-called power of is important. And I don't need another person to agree with me if I'm wrong. I need someone who can offer a different point of view, a different reflection. It's the reason I value my relationships across the consultant groups.
I want to, speaking of our audience, I want to remind everyone that you can ask questions in the Q&A feature. I'm just going to change my view here so that I can see, start to review questions as they come in. I do have another topic, Sally, that I'd like to pick up with you first, because I couldn't help but notice that you're participating in the Dialogue Project. And the Dialogue Project was created by my friend, Bob Feldman, and something that I've been, speaking with him informally about since he first had the idea. And I've just been so enthused by the purpose of that project, which is really to address the problem of polarization and bridge the, quote, dialogue divide, because we've become a society where we've become intolerant, you know, where people are intolerant of others who may disagree with their worldview, and it's a slippery slope. And I guess the thesis behind the Dialogue Project is that business has a role to play in restoring civil discourse. And do you think that's true? And what do we need to do in that respect?
Thank you for asking about the Dialogue Project, and thank you for introducing me to Bob Feldman all those years ago. And again, to folks listening on this call and looking for career tips, introducing yourself and others to people is one of the greatest ways that you can connect and network. I have loved the ability to meet people across the sector. I also strongly believe that companies can play a crucial role in advancing important societal aims. This one you're mentioning, Anna Maria, about the state of public discourse is very upsetting. The lack of civility, the inability to listen to one another is hugely problematic. I think that businesses and business leaders can make a huge difference in this regard. I think businesses and business leaders can make a huge difference in many, many sectors. I'm a strong supporter of the Business Roundtable.
Mm-hmm.
And I think their recent charge for companies to take a broader look at the stakeholders they represent, not just shareholders, but also all the broad reach of stakeholders is very, very important. And again, you know, sorry to bring everything back to COVID, but I think it required the heft and the commitment of the business community to move these medicines with this kind of independence and speed. So there's so many examples. This is something I feel so passionately about, that it's really driven my life and my career. You know, as a young person, I wanted to do good things in the world, as many young people do. Started my career in government, but pretty quickly switched over to business because I think business is a very powerful force for good.
Yeah, truly. We are starting to get some questions in, and continuing on that theme, actually, I think we have a really important question from Carolyn Smith. What do you think the responsibility is of communication professionals, especially those in scientific and medical fields, to counter fake and/or dangerous news?
Everything. I think if you are a science communicator or science professional right now, you should consider yourself conscripted into this national emergency. And, you know, with people politicizing science, you know, with people using bad information, I mean, imagine the compounded tragedy we would face if we produce an effective and safe and high quality vaccine that people are unwilling to take because they have ill-founded fears about the safety of the vaccine. So, you know, whether you're working in a bioscience company or not, whether you're supporting a client or not, if you have the intellect, the experience, the skills to speak out now in support of science, I hope you will. I really hope you will, because we need you and we need to get through this together.
Yeah, you know, I was thinking about some of what you were saying earlier about our role in influencing and you know, taking that type of principled and courageous approach. And you know, I thought that I'd talk a little bit with you about courage, because that's a topic that you have never shirked away from. And as someone who was on your team, I can remember vividly the times when you really encouraged all of us to, you know, step into the arena. And I think that you even actually said that, you know, you may not remember, but there was a, you do, there was a conference, and it was right around the time when Ian Reed became CEO. We had a sudden, unexpected CEO transition, and you had convened your team globally in New York on those very days, I think. And you handled that with such grace. And I just remember you encouraging us to, you know, to be a gladiator, to step into the arena, and to be a principal and, you know, a force for progress and change. And so I don't know if you want to share a few thoughts with us about about the importance or choice to be courageous in our field, and maybe also your own extraordinary experience at Pfizer alone. You've worked with 3 CEOs, and you've obviously not just survived all those transitions, but you've thrived and you've led the company through those transitions, which is really rare experience. So, just wanting to think about courage in corporate affairs and communication, and also advice you might have for people who are working directly with CEOs for the first time.
Mm-hmm. Thank you. I'm happy to riff on courage. And I remember very well the time and the incidents you're talking about. And I have to admit that I borrowed some of that language from a very famous quote about, it's called The Man in the Arena.
The Man in the Arena.
Yeah, I won't try to repeat it, Teddy Roosevelt. I won't try to repeat it, but I encourage people to look up this very famous Teddy Roosevelt quote, "The Man in the Arena," because it's inspiring to me. And for all of us who are working in this field, it's crucial to not only think of yourself as a behind-the-scenes player, but to step up and also be a vocal and visible leader and participant. It's not just our job to take notes and write things in obscurity and hand them to someone else to say. Of course, there's a lot of support in the work that we do, but there are also moments when you need to raise your voice and to be engaged in the process and be leading the conversation. And Pfizer has 5 bold moves. One of them is called leading the conversation. And I'm the sponsor of that one. I would also like to reflect on your comment about 3 CEOs at Pfizer. It's 3 CEOs at Pfizer, and it's 9 CEOs across the course of my career. 3 at American Express, 3 at Estee Lauder, and 3 at Pfizer. And sometimes people joke that maybe I'm bad luck for a CEO because that's a lot of them. But the secret to surviving these transitions, because they inevitably happen, is remember, you don't actually work for the CEO. You work for the company. And so Jeff Kindler was my boss, CEO of Pfizer, then Ian Reed, CEO of Pfizer, and now Albert Bourla, CEO of Pfizer. And of course, my office is right next to their office. Of course, I do my best to try to support them and help them. But whenever, at every turn, I say to myself, is this the right thing for Pfizer? And that often causes some uncomfortable conversations with CEOs. But it will give you that ability to thrive over the long term and not just survive day to day, but having that kind of North Star of, is this what's really right for the company?
Sally, thank you. And we're starting to get a couple more questions, some of which are very timely and also practical. There's a question around anti-vax sentiment. So what was Pfizer doing to address anti-vax sentiment before COVID? And are there any messages that can break through the skepticism and conspiracy theories that put vaccine potentially at risk?
Thank you for whoever sent in that very thoughtful question. Pfizer's one of the world's largest vaccine makers, and we've been making vaccines for a long time. Prevnar, our vaccine against pneumococcal pneumonia, is one of the largest vaccines in the world. So for years, we have been, advancing science, researching who are the most reputable spokespeople in support of vaccination. And of course, we're tripling down on that effort right now in support of COVID. And I'm working with many external partners. And in fact, Anna Maria, you and I should talk later about a project underway to really advance public confidence in vaccines. But here's a thought I'd like to share this morning, which is maybe we shouldn't call those people anti-vaxxers. I think the phrase anti-vaxxers is very negative and goes to what we were talking about earlier with the dialogue project of people pointing fingers at one another. The people who are fearful of vaccination, they're just trying to protect their families. They're perhaps frightened of what they don't know. Many, I find, have had inexplicable illness in their family. And when you're sad and you're scared, you cling to answers, right or wrong sometimes. And I believe this is a wonderful challenge to folks on the phone here and people who are working supporting Pfizer or other companies that are science companies and vaccine companies to try to recast this because the tone and tenor has gotten very, very negative.
It really has. And you're just reminding me of something that I learned, early in my career from, his name escapes me, but it's someone who I bet you know well, who was Bill Clinton's press secretary for a while, Mike. Oh, please.
Mike, it's not Mike McCurry.
McCurry.
Michael McCurry. Yeah.
Mike McCurry.
We're getting old.
Yeah, I know. How can I forget that? Mike McCurry was such a wonderful person, and he used to talk about the importance of having compassion for your audience and how that really makes people great and much more effective communicators. I would like to take the opportunity in the time that we have remaining, or not to miss the opportunity to also ask you about some of the important lessons you've learned over time about being a better leader, but also about being a happier human, because I think of you as someone who, thinks about that actively, and that you're very generous in sharing your insights with us on those points. And, I know that you're passionate about writing, and that you're sharing some of your perspective through how you write, both in nonfiction, personal essays, and hopefully one day in fiction. So anyway, tell us more about learning to be a better leader and a happier human.
Well, it does sound cliche, but sometimes I feel the more I know, the less the more I do, the less I know. I think that one of the important things is to remain curious as you age and not feel that you have all the answers. I love this field. I didn't intend to go into it. I didn't study it. I kind of fell into it, having left government and then moving into business and then finding my way to corporate affairs. But I think it is important to love your field. And you don't have to love it every day, but you have to feel that it feeds your soul and it provides you the opportunities that are meaningful to you. I do love to write, and I am trying to keep some notes about this period. I wrote an essay at the beginning of the pandemic that ran in Time magazine about the fact that I've let my hair go gray. I'm no longer coloring my hair during the pandemic. I just think it's important to put yourself out there, put your heart into the work. I like knowing people across this field. I am sincerely inviting everyone on this call to please connect with me on LinkedIn. I'm Sally Sussman at LinkedIn, and I read what other people say. I respond. I think that the engagement is just very, very important. And I value what I learn from younger people with less experience in the field, because I want to keep it fresh. I want to keep it exciting. And I'm very grateful for the ability to have this sort of purposeful work, especially right now.
We could have talked for a whole separate 45 minutes on the topic of diversity and inclusion.
Yes.
We for practical reasons, we didn't go in that direction, but we do have a question that I think is important to ask, and that is from Hanya Sharif, and that question is, what are your opinions on clinical research and the apparent lack of diversity and inclusion?
Mm-hmm. This is a crucial and important question. And in our clinical trials, we try very hard and share the aspiration of having trials be as diverse as possible. Presently, our COVID clinical trial is 10% African Americans, and it goes up to 30, almost 40% of non-Caucasians. So we've done very well on this COVID vaccine. But as the questioner probably knows, there's been a battle among communities of color to create the conditions of confidence in the clinical trials that date back to some very ugly period in our history. what's known, if you're not familiar with it, of the Tuskegee Airmen experiment, when terrible things were done to people in so-called pursuit of science. And so it's interesting because in some of the research I've conducted about who are the most impactful voices that can speak out in support of vaccine confidence, the number one was Dr. Fauci, and the number two was Barack Obama. So it's very clear that both in terms of clinical trial participation, but also ultimately vaccine acceptance, that we do everything possible to create the conditions of confidence so that we can have a broad trial, so that we can learn a lot, so that people are getting the best treatment they have. I mean, so many people have been marginalized in the healthcare system over time. And in order to beat that back, we begin with the clinical trial.
We have a related question, another good one, asking, will Pfizer have input into how the vaccine is distributed? And will there be an effort to ensure that hard-hit and underserved populations receive it either first, or in the right way?
So many good questions this morning from your very smart audience. I think many people may know that the FDA approves the vaccines, and then the CDC recommends for their use and distribution. Frankly, the CDC has fallen on some difficult times, and there are others who are weighing in as well on how vaccine distribution should happen. People may have seen that in the states of New York and California, the governors are saying they want to have their own sense of engagement on approval and distribution. So it's going to be a bit of a debate. And certainly, if the Pfizer vaccine is successful, regardless, we'll have a voice and views on how limited supply should be dispersed. And here's my view very quickly. Number one, I would give to frontline medical workers, because those people need to be protected so that our hospitals and our clinics are safe. I would then move very quickly to two additional communities. One is other essential workers that we need to keep our society moving forward, whether that's teachers or subway personnel, people who have been out there and having to work in the environment. And then, of course, the vulnerable and people with comorbidities. So that will be the elderly, people who have other chronic conditions, people who have been subject to some vicious healthcare disparities over time. So that means probably people like you and me, Anna Marie, will be the last. The healthy, the healthy people who have frankly, the privilege and the ability to work from home.
Yeah, exactly.
But I think there's a smart and a strategic way to do this, and we must do that.
We must. And Sally, we are getting more questions. We obviously have to start to wind down here. So I'm going to ask you one final question, which is really around advice for young people, and what advice you have for young people who want to enter the industry.
Well, I think one of the great things you can do is to find a place in one of wonderful agencies, many of whom are on this call, and where you feel you will get training, where you feel you will be exposed to senior leaders so that you can learn from them, where you will be allowed into meetings with important clients. And getting those kinds of experiences is really, really important. And the final thing I will say, because you mentioned it, is to read and to write. Reading the best materials. There's so many excellent statements and case studies that you can read about first class, best in class work in our field. And then to pick up the pen yourself. I have right by me here, my pad and paper, which I keep with me at all times, so that you are always becoming a better writer, because you cannot be a good communicator if you are not a good writer.
Yeah, that is so true. Sally, I'm getting a couple of notes. I got a message and a text asking, given the interest, if you and I have flexibility to extend another 10 minutes or so. I know
sure.
you're busy.
Sure, that's my honor and my pleasure. I'm happy to do it.
Okay, fantastic. Thank you. And that goes for me as well. So um, I'm also wondering about the problem of social issues today and the difficulty that we have as communicators in guiding our companies to engage appropriately on social issues. And you've definitely been the tip of the spear of that type of thinking on Pfizer's behalf for many years now. So how do communicators deal with the increasing expectation that companies take sides on social issues?
If you're not prepared for this question, it can really be the third rail in a company. And what we did at Pfizer and a project that I led that I feel very good about is I created a social framework to allow us to answer the questions, because questions come at you furiously. You know, should we support this women's march? You know, are we for flying the Black Lives Flag matter at our plant? You know, you couldn't possibly do a deep analysis on every question and stay ahead of the curve. So we created a framework. You know, Pfizer is a very metric-driven company. We make decisions based on algorithms and deep analysis, and I needed something that I could hang my hat on when advising people, should we support this and should we support that? So we created a very simple framework with just a few questions. So here, I can give it to you very cleanly.
Good.
One is, does this question support Pfizer's purpose, breakthroughs that change patients' lives? So something might be a very good cause, but if it's not a cause where we have agency, then we should not be weighing in on it. You know,
Right.
Companies only get so many chances to make a difference. So you don't want to weigh in everything and squander your power. The second question is, how does it relate to our values? Not our political beliefs, but our values. And Pfizer has 4 values: courage, excellence, equity, and joy. And if it's not a direct hit on one of those 4 new values, we introduced them last year, then we take a pass. Third is, how does it impact our most important constituencies? And I believe a company's most important constituency is always its employees. So are your employees engaged in this issue? So for example, there was a march in support of science. We did endorse and sponsor that march because we're a science company and we have many scientists who work at Pfizer. So how does it affect the communities you serve? 4 out of, and the fourth question, there are 5, is what are our options for acting? Because sometimes you're presented with something like, sign this petition, put your name on this ad. Well, you could do that, but there's probably other things you could do. You don't have to have a binary decision for the thing you're confronted by. Maybe you don't want to sign a petition, but you would like a statement from the CEO to your employees. And then the 5th, and probably sometimes the most interesting question is, what is the price of our silence if we don't speak? And so anytime we get a question, we put it through that wheelhouse, that framework, and have an answer we can all live with. It's not always one everybody likes, but it's one we can live with.
It's a fantastic framework. Thank you. You know, you have so much to offer us to bring to this community. It's been a privilege to host you today, Sally. And, you know, a final thought I just want to leave with the audience, especially those of you who might be earlier in your careers. Sally is a wonderful example, not just of someone who leads in the industry, but someone who leads for business and for society. And I can tell you, as someone who's known her a long time, has worked alongside her, and who knows, you know, some of the things that the public will never see, that it's, you know, leaders like Sally in our discipline make a huge difference for employees, for communities. I think that there are patients who are doing better with their health because of Sally. There are people who are alive because of Sally. So Sally, thank you not just for being here today, but for everything you do with your life.
Thank you, Anna Maria. Thank you very much. Appreciate it.
Okay, Arun, back to you.
Thank you so much, Sally and Anna Maria. What a fantastic conversation. Honest, engaging, empathetic, and compassionate. What a great way to start a day. And thank you for extending. We did get a lot of questions coming in, so we felt that was worthwhile too. Some really great learnings from that session, I think, for any of us that are involved in this profession. And one of the phrases that really stuck with me that Sally said was, how can this moment become a movement? So one of the many smart things I feel that Sally said in that session, and a very appropriate phrase for our next session. So let me thank you both, and we will move on to our next session.